Hi everyone, greetings from Dr. Paul's Advanced Hair and Skin Solutions. I am Dr. Raktim Bhattacharya, working as a senior consultant at Dr. Paul's. Well, today I am here to discuss about generalized hair loss. Hair, as we all know, is a sign of beauty and confidence. So without hair, we can't imagine anything in life. So to know about hair loss, first of all, you should know its types, its character, its classifications, its causes, and most importantly, the treatment which is required for his or her condition, depending upon his or her condition. So first of all, let's talk about the types. The first type is androgenic alopecia. This is the most common type of baldness or alopecia, whatever you say, which is commonly encountered by men and women, but definitely men on a higher proportion. Here, the crown area is mainly affected. After that, it progresses inwards, making a horseshoe pattern. In females, the crown area relatively is less affected. In fact, I will say that it is not affected. The second part is traction alopecia. This is mainly a man-made alopecia where the hair is pulled in such a tight manner backwards so that vigorous hair fall occurs. So the suggestion is to put the hair in such a manner or to tie the hair in such a manner so that it gets loosened. Then only this condition will be recovered. The third one is involutional alopecia. This occurs mainly due to old age, where the hair becomes thin and the hair cycle becomes shorter. So definitely in this age, we should put stress on our nutritional intake and as much as possible, don't take so much of dominating stress. The next one is alopecia areata. This is basically an autoimmune disorder where the hair loss occurs in patches. First of all, a pea-sized patch occurs in the head or wherever in the body where the hairs are present, and ultimately it goes on increasing by patches. Numbers of patches are increased. So this is basically an immunity disorder which can be recovered with the help of fusion homeopathy and other therapies. The next one is tinea capitis. Again, this is a fungal infection where hair loss occurs in patches, in singular or in multiple patches. The last one is telogen effluvium. This is basically a temporary hair loss which mainly occurs after childbirth. If a person is having a stressful event, experiencing stressful event, he or she will definitely have such type of hair loss which is termed as telogen effluvium. But definitely this is temporary. If proper care is taken, it can be recovered. Now we will discuss about the causes of hair loss. Hair loss has got multiple causes. The first one is if someone is having excessive dominating stress and anxiety. It has been observed that the people who are having predominating stress and anxiety creates a lot of hair loss rather than the persons who are having low tension or stress or anxiety having less hair fall. So having a predominating stress and anxiety definitely will lead to a vigorous hair loss. The next one is hypo or hyperthyroidism. Both the things, if it is not in a proportionate manner in the body, then definitely drastic hair loss may occur. Third one, medications. If someone is having antidepressants, anticoagulants or beta blockers, such type of medications induces maximum hair fall. The fourth one is genetic inheritance. If someone in the family having his or her father or mother or anyone in the maternal side or paternal side having such type of baldness in a very early age or in a very extreme age, definitely he or she have a tendency to get the baldness in a very early age or in a very extreme age. Lastly, hormonal changes. During menopause or after childbirth, due to hormonal imbalance, hair loss occurs in a very drastic manner. If proper steps are taken, then definitely it can be controlled. These are mainly the root causes of hair fall. Apart from that, there are some other several factors also. So definitely, if the proper root cause is ruled out and the proper treatment is given, the patient can be recovered definitely if it is detected in a very early stage. Now let's talk about the treatment part. Treatment depends upon the condition that he or she is having. But the most approved treatments what we have regarding hair loss is the first one is cyclical program, vitamin cyclical program, where a vitamin combination will be provided to the patient depending upon his or her state. And this is a combination of vitamins and minerals which will not only reduce the hair fall but create a condition in the scalp where a healthy hair can survive. Because if your scalp is not up to the mark, you can't expect that your healthy hairs will survive there. So in taking the medication and keeping an unhygienic condition in your scalp will not suffice the condition. So you have to keep your scalp in a proper hygienic manner, and along with that, if you are intaking the medications in a proper way as per the doctor's advice, definitely it will help you out. Secondly, therapies. Therapies are the combination of creams, shampoos and some treatments which will be given in a combined way, which will definitely help you in reducing your hair fall and to a certain extent grow your hair. Third is surgery. Surgery, as we all know, this is the hair transplantation which occurs mainly after the 5th or 6th grade of baldness, where most of the part of the scalp is totally bald and non-follicular. Then we have to pluck it from the donor area, which is the back side of the neck, and make it implant wherever the hairs are required. Fourth is IPRF. This is one of the most important next generation PRP. And PRP also, before that I will mention, this is very growth inducing factor, where we have to collect the growth factor from the individual's blood platelet. After centrifusing, we definitely inject that, and that growth factor induces the hair follicles, and ultimately the hair grows in a very proper manner. These are all the medications which are applicable as per the patient's requirement. Without doing any false commitment, the doctor should first of all judge what he or she requires. If the patient is in a very early stage, then medications definitely will help him out or help her out. But if the patient has gone to a certain extent where the medications are not helpful, then definitely surgery is the only way out, or PRP or IPRF is the only way out where the hairs will grow. My main intention at Dr. Paul's is to give a patient a better look which he or she requires. Be positive, stay healthy and take care of your hairs. Thank you very much.